Welcome to this introduction to Integrative Psychiatry. Integrative Psychiatry involves a whole-person exploration aimed at identifying the root causes of psychiatric symptoms and experiences. This includes an exploration of mind, body, lifestyle, and spirituality. The leaves of the tree represent individual symptoms, whereas a collection of leaves represents an experience or syndrome. The larger and dividing branches leading to the leaves represent chronic and acute neurological changes and correspond with neurological pathways. As the limbs of the tree converge into the trunk, we enter the territory of the body. Here we consider how bodily systems, such as the gastrointestinal, immune, endocrine, and metabolic systems, among others, impact the branches of the tree. Or in other words, how bodily systems impact neurological pathways. At the base of the tree, we have genetic and epigenetic factors that inform susceptibility. Surrounding the root systems are vitamins and micronutrients that are required for the structural and functional basis of the tree. Lifestyle factors such as relationships, resources, leisure, nutrition, exercise, sleep, and substances or addictions are represented as water and can either help or hinder adequate growth, development, and resiliency. Mind and spirit surround the tree, informing an individual's narrative or life story, meaning, and purpose. Between 1990 and 2019, the global number of disability-adjusted life years due to mental illness increased from 80.8 million to 125.3 million. Mental health disorders remain among the top 10 leading causes of burden worldwide, with no evidence of reduction since 1990. According to the World Health Organization, depression is the leading cause of disability worldwide and is predicted by 2030 to be the leading cause of global burden of disease. Worldwide, more than 70% of individuals who need mental health services lack access to care. For those who do receive care, pharmacological treatments may or may not be effective. Several studies have identified that antidepressants come with small effect sizes, or may be equivalent to placebo. Likewise, in an extensive review and analysis of the literature from the 1950s to the present, antipsychotics were found to provide short-term benefits, but may worsen outcomes in the long term. Other discrepancies in treatment are recognizable in clinical practice. Practicing mental health clinicians are aware of some of these long-term outcome issues, in addition to the frustration of treatment resistance. In the United States, 1 in 5 adults experience a mental illness ranging from mild to severe. The bottom line is psychiatric illness is a widespread problem, imposing tremendous burden, but perhaps our current model is not the most effective for addressing this growing issue. Integrative psychiatry may present as a more effective alternative to the current model. Conventional psychiatry focuses on syndromes and symptom clusters, whereas integrative psychiatry focuses on root causes. The pathologizing of syndromes and symptom clusters can be stigmatizing. Conventional psychiatry tends to evaluate individuals using a checklist approach to identify a diagnosis based on an idiopathic cluster of symptoms. This labeling can be misleading, as it is unlinked from etiology and stigmatizing. Integrative psychiatry aims to identify the etiology of these symptoms and maintains a more comprehensive evaluative process. A significant portion of mental health research focuses on genetic predisposition. However, no consistent genetic cause of psychiatric illness has been identified. Conventional psychiatry orients treatment around symptom reduction, with a toolkit that weighs heavily on pharmaceutical options, whereas integrative psychiatry expands this toolkit to include nutraceuticals and other alternative treatments aimed at root causes. Among conventional treatments used in psychiatry today, oftentimes providers run into issues with partial response, non-response, or a waning response. The role of practitioner in integrative psychiatry is more of a guide, entering the treatment discussion by presenting in-the-box and out-of-the-box options, and allow the patient to make an informed and autonomous decision. Throughout this course, we will examine a variety of in-the-box and out-of-the-box modalities, guided by an integrative model of treatment. In addition to filling the gap between academia and practice, This course will consider an expanded toolkit that incorporates relevant evidence-based support. Armed with this expanded toolkit and an understanding of the root causes of mental illness, we can stop sorting through the leaves and consider the whole person. Thank you for listening.